Wish TV is the only local station with a team of health experts. I'm joined by Wish TV medical expert, former U.S. Surgeon General Dr. Jerome Adams,
Hello.
and News 8's medical reporter, Dr. Mary Gillis. We're glad to have you both here today.
Thank you, Brenna.
We've got to start with the news of the week, the Delta variant and some of the implications that have coming from that, spreading, the return of face masks and more. Some are saying this Delta variant is different than, I guess, what I'll call the COVID of 2020. Dr. Adams, what's your thoughts on that?
Well, I couldn't have put it any better than you did. It is a very different COVID that we're dealing with. COVID before, one person would spread it to 2 to 3 people on average if they had it and they were unvaccinated. This new Delta variant, we're spreading it to 8 to 9 people who are unvaccinated. Or to put a different way, they did a study and they found that there were 1,000 times the viral particles being emitted by someone who has this Delta variant as compared to the original variant. And that's why you're seeing cases skyrocketing, increasing 60% in the last week, 300% over the last 4 to 5 weeks, according to the CDC, and hospitalizations really going through the roof.
So the fear is people shedding this virus everywhere, so you think, okay, mask up so you don't shed it. And Dr. Gillis, I know you covered the CDC's recommendation to put masks back on extensively this week. Do you think that should have been a mandate?
Well, it's interesting because we have vaccinated versus unvaccinated, and the CDC just came out previously, a couple weeks ago. It was a sweeping statement that or for what they know so far, right, we were still figuring things out, that milder symptoms were with the Delta variant, which was kind of upside down, right? Because you think if it's more infectious, as Dr. Adams said, 100 or 1,000 times more viral load, you'd think it would be, you'd have more severe symptoms. But we have runny nose, we have sneezing, we have common cold. So it could be easily mistaken as a common cold. So that was previously what the symptoms are. But now we have it parsed out between vaccinated people and unvaccinated people. So vaccinated people have those symptoms of a common cold. However, unvaccinated people have the original COVID-19 symptoms, such as severe headache and fatigue and loss of taste and smell. But the question is, Dr. Adams, I want to get your thoughts on this. So if you have a Delta variant and those symptoms are sneezing and coughing, you're going to transmit that, right, more so than you are going to if you're fatigued. So that I'm thinking behind that study, as you had mentioned, the 1,000 times more viral load. In that same study, it was 220% times more transmissible. And I'm thinking that's the reason you're going to spread it through a runny nose and a sneezing, not through fatigue and a headache.
Well, exactly. And I think it's important to the point that you raised, for people to understand we have different ways to protect ourselves against coronavirus. We have vaccinations, which are still incredibly effective at preventing severe disease and hospitalization. And I would encourage your viewers, if you haven't been vaccinated yet, please get vaccinated. But we also have testing. We also have mitigation measures such as masking. We have ventilation. And right now, we had this discussion, and I think people should know beforehand, we're all vaccinated, we're spread out, and we're in a well-ventilated area, so we aren't masking. But what the CDC is saying is, look, in an environment where people are coming together indoors and we can't tell if you're vaccinated or not, we absolutely need to protect each other by wearing masks.
Now, you've worked among these big national agencies, right, the CDC. Why is their messaging sometimes confusing? And Dr. Gillis hit on this too. For a while, it was no masks, then it was masks, then it was no masks for vaccinated, and now it's masks for everyone. Why is their messaging changing so frequently, and are they having a problem with it?
Well, you know, one of the things that we both know is that you don't get training in communication when you're going through school for your MD or your PhD. So scientists and doctors aren't always great communicators, number one. Number two, people need to understand that science isn't about a final definitive answer. It's about a journey, a continual search. And this virus keeps pivoting, and the CDC is struggling to help communicate to the public that wants certainty. Should we mask or not? And final answer, should we get vaccinated or not? Final answer, that hey, this may change. You may need a booster. You may be able to take off mask today because you're in an area of low transmission, but 3 weeks from now, you may be in a place of high transmission.
But does that undermine the trust that people have with those in power or those in medical power who may have had a negative experience with a doctor in the past and say, well, that's it, I can't trust what they say because they keep changing and I want it to be definitive?
Well, I want to hear from Dr. Gillis on this, but I say absolutely it does. But the problem is we have a lot of people with other agendas who are preying on people's mistrust, and it's up to people like us, and that's why I'm really glad we're here today having this conversation to explain the science and the scientific process to people. And Dr. Gillis does it so well, but we need to do a better job of that.
Yeah, and I would just want to say, Dr. Adams, you are so right. Doctors, they have their own language, right? They're speaking to one another. They're not necessarily able to communicate it to people who have some sort of whatever grade level the national average is.
Well, if you and I had a conversation doctor to doctor, it would not be the same conversation we would have with my mother or someone in your family.
Right, so let's put this as easy as possible. And I want to talk about what you were following up on, or what you're saying in terms of research. Last year, we were doing ethical research. We were having a question. We had a hypothesis. Would it be our question, is this true or is this could be not true? We would have the methods in which we would test. We would have our how we were going to statistically measure it. We would have our results, we would have discussion and limitations. That's how we would do things.
Exactly.
And that's why things changed. We didn't have the evidence yet. And I think when people know the scientific process, if they have the understanding of that, then okay, we didn't know. But as you keep saying, Dr. Adams, and as we're trying to get the message out there, it does evolve. I mean, for Dr. Fauci to say we've never seen anything like this before, we have to understand, and there has to be a little bit of, I would say, forgiveness. Yes, it is confusing, but it's a process. It's emerging.
And she brought up a point I just want to say to you, because it struck me. I have had the pleasure of having several conversations with Dr. Fauci, both when we worked together, but now, and Dr. Fauci has been doing this for over 40 years. He says, I've never seen a virus as tricky, a virus that continues to flummox us as much as COVID. And I think we need to be honest with the public about that and help them understand that you want your scientists to show a little humility and to say, look, what we thought we knew based on the information we had last year or last month has changed. And so we're giving you better guidance now based on what we know.
Honesty is what a lot of our viewers are asking for. There are some things that we trust decades in the making, and that's FDA approval. And with the emergency use authorization, some of our viewers have said, well, I don't trust it because it's not fully approved. Is that coming, and will that make a difference?
Well, Dr. Adams, I don't know. That's my question. What's the holdup?
Well, and one of the things that's important for viewers to know is that the safety data, the efficacy data is there. I've talked to people within the FDA. I've talked with Dr. Scott Gottlieb, the former FDA commissioner, and what I've been assured is that right now they're looking at the manufacturing of the drug and the final steps that it takes to get that full licensure over the finish line. But we've had hundreds of millions of people get these vaccines across the planet, and no one's grown an extra head, no one's sprouted an extra toe or an extra finger. These vaccines are safe, they're highly effective, and anyone can look at the data out there and see the hospitalization rates in places that have low vaccinations versus the ones that have high vaccination levels. These vaccines are effective, but we do need FDA licensure. And here's the thing about licensure. To me, it's not so much about hesitation. It's about, and you heard the president recently make an announcement about this, it's about employers saying, hey, we don't feel like we can compel people to get a vaccine that's not fully licensed. I think once we get that licensure, you'll see the military mandate vaccines. You'll see other businesses get a little stronger, like the NFL has lately too.
Big predictions. I want to thank you both for coming in and sharing your points of view on an issue that continues to evolve. Of course, former U.S. Surgeon General Dr. Jerome Adams and our Wish TV medical reporter Dr. Mary Gillis.
Brenda, thank you. Such
Thank
a pleasure.
Important
We
things.
need to do this more often.
Exactly. We'll have to plan that then. Thank you.